Okay, we are live now.
Awesome. Hey everyone, welcome back to another session. Today we have Dr. King. She's going to be telling us about any advice, her journey, and honestly anything else she has for us. So thank you so much for joining us. We really appreciate it. And whenever you're ready, you can begin.
Thank you, Mira and Avril. It's my pleasure. Thanks for inviting me. So on my name is Marisol King. I live in Albuquerque, New Mexico. New Mexico is a state in the United States. I have to remind all of my cousins in New York every time I go visit for the last 34 years. Yep, we're in between Texas, Arizona, and right beneath Colorado. My front screen says Pacific Dental Services on it because I am a Pacific Dental Services supported dentist. And I'll talk about that a little bit here in a moment. So I'm going to leave my information here on this front screen, and I'll also have my information at the end of this presentation. But you can, at the end of this, please feel free to call my office, to email me. You can message me on Instagram. I imagine that most of you are very early on in your career as pre-dental students. Maybe you're not even pre-dental, maybe you just want to learn more about dentistry, but please feel free to reach out. I didn't have any dentists in my family. I was the first one that chose this fantastic, albeit crazy profession, and I haven't regretted it for a moment. So if maybe you're in my situation, feel free to get in touch. So this is a picture of my backyard here in New Mexico. We have ironically, we have over 300 days of sun, and I happen to choose a photo of a cloudy day with a rainbow. So that just goes to show you how we appreciate the clouds. So if you live in somewhere cloudy, I feel you. If you need some sunlight, always come visit us. Boy, we have enough to go around. But those are the mountains. I just want to give you an idea of where I live. A lot of people think about New Mexico like it's pure desert. We do have the occasional tumbleweed, but we do, contrary to popular opinion, we do not ride donkeys to work. I live in the biggest city in New Mexico. Albuquerque and its surrounding suburbs. We have a little over 1.5 million people, or maybe under that. For a big state, we're the 5th largest state in the country. We don't have a lot of people, so Albuquerque kind of lies somewhere in the center. So this is my view every day when there's daylight out and I come home and I get to see the mountains. This is where I practice right now. I'm the owner of Cottonwood Smiles Dentistry. It's about a 10-minute drive down the road. Absolutely, I chose this practice for my commute, but ultimately, I think the practice chose me in terms of longevity. I love where I work. I absolutely love it. This is a photo I took very early on in 2020. We are kind of off the road, and a lot of people thought that dentists closed their doors entirely to patients when the pandemic first began. And a lot of dentists chose to do that. My husband is also a general dentist. We chose to stay open for emergency care. We thought it was really important. That was the way we contributed to helping our fellow healthcare professionals that were in emergency departments that were overwhelmed by the amount of patients that were coming to see them. We thought the way to supplement that is by staying open for dental emergencies so that those patients wouldn't end up in ERs. So my fantastic artistic dental assistant came in and painted that open for dental emergencies on my window. So I imagine all of you have asked yourself this question, or maybe you've answered it. You want to be a dentist, but why? So I think that my why has probably changed maybe 4 or 5 times since I decided to choose this career and work hard in undergraduate to get accepted into dental school. When I was writing my personal statement and I was trying to explain to someone I'd never met before on a piece of paper why I wanted to be a dentist. And I want all of you to really think about your why. And I'm going to reference this throughout me talking to you this evening. I want you to write it down, not just your personal statement, but write it down for you. What's your why? And I want you to look at this throughout the next couple of years. And ultimately, if you decide to apply to dental school, if you're lucky enough, let's say it, if you're lucky enough to get in, I consider myself very lucky, very blessed. Look at it throughout dental school. Maybe write it in a note in your phone, right? Just somewhere that you can reference it. Because it's very interesting as you reflect on your original why, how it kind of changes. So I think there's no shame in saying that it's kind of well understood that dentists make a good income, and you shouldn't be ashamed at thinking about that. I certainly thought about that as a female dentist, giving no healthcare providers in my family, and I was the first one to pursue higher education. I am half Guatemalan, half Irish. My dad is first generation Irish American. My mom is a Guatemalan immigrant. And someone said the right thing to me in one of my continuing care exams at my general dentist. And that's what ultimately planted the seed. And that's why I am here today. So whatever your why is, think about that, reference it, and find out what keeps you going, what keeps you interested in this profession. Maybe it's a person, maybe it's an idea of what you'll do. We all say we want to help people. I think that's well understood when you're a healthcare provider. But think more, think deeper than that. Why do you want to do this? So I'm going to briefly touch on this because it's at the forefront of everyone's mind. It certainly was for me when I applied to dental school. But there's a couple of things that just have to be good when you apply, when you're getting ready to apply to dental school. You have to be a good student. You think that you have a lot of exams right now in undergraduate. I remember like a couple of all-nighters that I pulled studying for exams, but I want to break it to you that everyone that applies to dental school is a good student. So what do you need? High GPA? Absolutely. Science GPA is something that they really focus on. And I'm just going to spend a brief moment on this. The thing that scared me the most, of course, in my application, the DAT. Some of you will take it more than once. Some of you will hedge all your bets on that first time. So you're going to come prepared and make sure you get a great score on it. This is the dental aptitude test, dental admissions test. You want to do well on it. They're going to look at it. And then your overall application, right? So your extracurriculars, your clubs, your shadowing experience. But what else? So I talked to you about your why. And most of us write about that in our personal statement, right? What's our why? We had an experience, we had a conversation, we witnessed something, we overheard something. And that got us interested. Now you're going to think about your why and you're going to translate that on a piece of paper that someone else is going to read. And that first sentence, those first couple of sentences in your personal statement, how are you going to translate what makes you different from everyone else that is applying to school? I'd say right now, in what you're doing as undergraduates, pre-dental students, you're working towards developing yourself on a little packet of paper that you're going to submit to someone. And that person is going to try and get to know you through that little packet. So working hard towards making that a strong application is really good. But remember that you're going to be with the best of the best of the best. I'll never forget my dad telling me this when I applied to dental school. I was very overwhelmed. I actually took a year off between my undergraduate and dental school just to kind of refocus, work, save some money, take a break. And for me, that was the best decision I could have ever made. I went to undergraduate when I was 17. I spent 5 years finishing 2 degrees. I worked very hard. I had a lot of fun. I made great friends, but it was hard work and I needed a break. Some of you will do undergraduate in 3 years and go straight through to dental school. You're ready. You just got to figure out what's best for you. But when you make this application, certainly they're going to pull candidates from this pile with great GPAs, great science GPAs, great DAT scores. And then from that pile, what's going to make you be selected for an interview? All right, that's it. You applied, you did it, you are the best of the best, you were selected, and now you're in. What do you expect? I went to the University of Colorado. I was so lucky that I was able to be accepted into the dental school that was closest to home. Aurora, Colorado, where the Anschutz Medical Campus is, where the dental school is about a 5-hour drive from where I grew up. I love my family. I needed to see them occasionally on the weekend, so I would drive home. So the picture on the left, that's in a lecture. And the irony of this picture, as I was going through all my photos from dental school and kind of choosing ones that I was going to put on here, is that right there is the Pacific Dental Services logo. And this lecture was given by, I must have been maybe a recruiter for them. I really can't remember. But what struck me, and I remember this, is that they were talking about service and about volunteer opportunities when you are a Pacific Dental Services supported clinician. And just to come full circle, I graduated in 2014. So I've been practicing a little while, long enough to make me a little more dangerous than I was the first year I graduated. But one of my whys was not just helping people, but doing it for the people that I thought needed it most. I told you my mom's from Guatemala. Guatemala is a country in Central America. Many of you might know that, many of you might not. But they were talking about in this lecture that they were going to open a clinic in Guatemala and do free dentistry there. It was just a conversation about it being created. And I remember thinking, I've got to take a picture of this because I want to remember to look this up later. And they were also talking about a day of service that collaboratively every dentist can select to participate in yearly as a Pacific Dental Services supported clinician, a day of service that you're giving back to your community. So in my practice, I participate in this We Serve Day, and we choose patients in my practice that we really feel are very deserving of free dental work. We've collaborated with a group that helps wrongfully incarcerated people who are newly released get the dentistry that they need. That's been another group that's been near and dear to my heart. So I took that photo in full circle. I had no idea that I was going to work in a PDS supported clinic, but there it is. The middle photo is the last patient I ever saw in school. This was the very last day of clinic. There are many different requirements that you have in dental school, and you'll have the opportunity to do a lot of unique things. And this for me was just spectacular. I have a photo of her teeth on the right when we finished. So this woman was originally from Mexico. She had neglected her dental care. She lost many teeth, most of them to periodontal disease or decay. And she really struggled with her self-esteem and confidence. And when she became my patient in dental school, we were talking about ways to get her front 6 teeth that she was missing. And she had worked with one of the residents in our periodontal residency, and they are specialists that focus on treating the gums, the jawbone, the supporting, for those of you who don't know what a periodontist is, the supporting structures that keep teeth in the mouth. They're more familiar with implant dentistry. And they had placed implants, and my last, we'll call it project in dental school, was to restore her front 6 teeth on implants. And I got to see this all the way through. So what you see in the middle is a person who regained her confidence, self-esteem, and on the right is the prosthetic that we made for her. So what to expect in dental school? Everything. It is the happiness that I experienced when I got that phone call that I was accepted. I'll never forget that. I was at home. I think I was watching TV with my mom, but I remember I was watching something, and you're like anxiously carrying around your cell phone as soon as that day passes where you know acceptances are going to be sent out. And I saw my phone ring with a number that I didn't recognize, and you answer hesitantly because you don't know what to expect. And it was the admissions office from the University of Colorado. And I yelled, I started crying, and I really tried to remember that moment on my hardest day in dental school, hardest days, I should say, because there's not just one, there'll be many. I told you that you have a lot of exams right now in undergraduate. Well, multiply that times 2 or 3. That's what you'll expect in dental school. For many of you, maybe you'll get through it and it'll be no problem. It'll be easy. For some of you, it'll be the hardest thing you've ever done in your life. I think I fall more in that category. It was very overwhelming, the amount of work, exams, homework, projects, organization that was required to get through it. But ultimately rewarding, because patient care for me, and we started that at the end of our second year at the University of Colorado, was just exceptionally wonderful. You will be with like-minded individuals who are ultimately trying to achieve the same goal of graduation, and you'll think about what you want to do after dental school. Do you want to practice general dentistry? Do you want to get into one of the 9 recognized dental specialties or the residency afterward? Do you want to do an additional year in a general practice residency or an advanced education in general dentistry just to learn more about what it is to be a dentist? Do you want to own your own practice? Do you want to get into public health? Do you want to find someone to help you? I mean, all of those things you think about as you go through this really difficult time in your life, but you're around people who do it with you, and you have people who have already done it there, so you get a lot of support. All right, so you get through dental school, and the best day post graduating from undergraduate and getting that acceptance phone call is graduation. So this was graduation day, and I was really lucky to be hooded by one of my really close friends and my mentor, Dr. Elizabeth Prishkolnik, who's a very short dentist on my right in the right photo. And the very tall, good-looking guy is my husband, who is already a year in practice, who had graduated before me. I remember this, again, like it was yesterday. It was such a relief, guys. It was such a relief to graduate and finally have done this thing that I worked so hard to achieve. So again, I'm going to go back to my why. When I was about 13 years old, I had a continuing care exam at my general dental office, and I had a young female general dentist who actually was pregnant the majority of the time that I knew her. And she, in conversation and the conversations that I even have with my patients now, asked me, Marisol, have you ever thought about what you want to be when you grow up? And then honestly, I don't know who asked the 13-year-old that, or like what 13-year-olds know, but I threw out there, I want to be a doctor, right? Like you see all these medical dramas and you're like, that's how I'm going to help people. That's how I'm going to make my impact in the world. I'm going to be a successful doctor. I'm going to make a good living. I'm going to help a tremendous amount of people. I mean, I just thought, well, yeah, that's what I'm going to do. I want to be a doctor. And my general dentist at the time, Dr. Jody McGrady, she said, well, have you ever thought about being a dentist? And at the time, I thought dentistry was like an associate's degree. I didn't know anything about it. I didn't think it was hard. I didn't think that, I thought it was more like a trade. And I told her, oh, no, I want to go to college, and then I want to go to medical school. And she's like, I'm sure, oh my gosh, at the time, she's probably like rolling her eyes thinking like, who is this crazy little 13-year-old? But remember, she asked me what I wanted to be when I grew up. So she said, the one thing that really probably would ignite a fire under most of us that are tremendously competitive and want to get into healthcare professional schools, dental school is actually more difficult to get into than medical school because there are fewer of them. Okay, so ears perk up, right? Competitive little 13-year-old. And you have the ability to fix people's problems and pain in one day. And everything is so hands-on. And you get to have conversations with new people and get to know people more every day of your career. So my whys, I wanted to help people, but more than that, I wanted to help those who needed me most. I love fixing things. I didn't recognize this until about third, maybe the beginning of fourth year of dental school. It's one thing to say like, oh, I want to give people their confidence back by fixing their front teeth. I showed you my final senior project in dental school. But the satisfaction I get from fixing something, from taking apart and putting it back together, I can't even begin to explain that feeling of gratification that I get from that. And I am a talker. If you haven't picked that up by now, I am a talker. I love talking to people. And it's fantastic, guys, because every day I can talk to people and they can't talk back. So General does everything that I want to do. And then they do talk back. And I get to see generations of patients. I have great-grandparents, grandparents, their children, and their children's children in my practice. And this isn't just like one family I have. I have many families like this where I see generational families. And again, I'm going to reference my why throughout this lecture, but I remember that general dentist saying those things to me, Dr. Jody McGrady. And that day I went to our local Walmart. I bought my first pair of scrubs. She invited me, a 13-year-old, back to her office so that I could watch her. And it was everything I wanted to do. And I will say that she made it look very easy. It is not easy, but she'd been doing it a while too. And from that moment on, from 13 on, I wanted to be a dentist. And here I am. So I have her to thank for it. And now Dr. Jody McGrady is a pediatric dentist and my mentor. So I mentioned another person, Dr. Elizabeth Prishkolnik, in this picture. I met her in college through a mutual friend, and she gave me the opportunity to work in her practice rather than just shadow, but to actually work as a dental assistant in her practice. And that really added to the confirmation that I needed that I was choosing the right profession for myself. And she was there as a supportive friend, as an understanding, supportive friend throughout my entire journey, because I told you I didn't have family members that were healthcare providers or that had pursued dentistry, I should say. And so Elizabeth supported me in that. All right. So I graduated from dental school and I found a job. I will tell you, you're going to remember this after this lecture, that I did everything they told me not to when I was learning about how to find your first job in dental school. It is overwhelming. There's lots of opportunity, lots and lots, especially now. Oh boy, there is so much opportunity in dentistry. I was talking to Mahira and Avril a little bit before we started. Last year was a scary year. I can't imagine graduating from school in 2020 because there weren't a lot of jobs immediately out of school. Many of us were closed to emergency dental care only. Some of us closed our doors altogether. And even my husband and we had to furlough our associates. We couldn't afford to keep them on in practice. But once we reopened as a country, dental offices to preventative care again, because we understood really the importance of maintaining your oral hygiene and how that dentists could do it very safely, that we're very well trained to treat patients very safely, more so than many other healthcare providers out there. And the floodgates reopened and people realized the importance of receiving dental care, and I'm busier than ever now. So my first job, my husband's from Arizona, and he participated in the WICHE program. For those of you who don't know what that is, it stands for the Western Interstate Commission for Higher Education. So there's some reciprocity with our states and dental schools, certain states and dental schools, I should say. But if you don't have a state dental program, New Mexico does not have a state dental program. Arizona doesn't have its state dental program. It has 2 private dental schools, but not a state dental program. If you apply to this program and you are accepted, then you receive the equivalent of in-state tuition in dental school, as long as you promise to practice back in the state that supported you in this reciprocity. So my husband was part of the WICHE program. So after dental school, he had to return to the state of Arizona to do 4 years of practice to pay back the loans that were supported for him, or the tuition that was supported for him. So when the way I found my first job was I wrote a letter. I wrote about who I was. I made a resume, and I snail mailed this to 50 offices in a circle around the place where we wanted to live. So I went onto Google Maps. That's where we're going to live. I was going to practice in this vicinity. I snail mailed to 50 offices. From the 50 I mailed this resume to, I was unbelievably lucky. I heard back from 20 of them. And from those 20, I ended up actually going to 8 interviews. And the person that you see here is Dr. Amber Angel. She is a wonderful, wonderful general dentist in Phoenix. And she was pregnant when she interviewed me. I have this thing about great female dentists who are pregnant when I meet them. And she was looking for her first associate. So in dental school, they will tell you, make sure that you are not this doctor's first associate, because you will be learning together. I will tell you that I was the dentist who hired someone as their first associate. So it happens. It did go full circle. She didn't know anything about hiring an associate. I didn't know anything about a job as a general dentist. I just knew her practice was nearby where I wanted to live. I liked the way she practiced. Her ethics and morals were very similar to mine. She had a wonderful social media base. The reviews of her practice were wonderful. So you see me looking her up on social media and her reviews before I went to find a job there. And we really clicked. We clicked well. But since she never had an associate, I didn't have a contract. So I signed up on a handshake agreement. And that meant there was nothing on a line where I signed that said anything about how I was paid. But I was very lucky. And I was very lucky that she is a wonderful person. And this was a tremendous year of growing in private practice in my first year of dental school, right out of school. So I really owe a lot to her that first year. After the first year in practice in Phoenix, my husband and I were kind of thinking about where we were going to go long-term in our career and what we were going to do, whether or not we were going to buy a practice or build a practice, where there was a potential for practice ownership. We were kind of thinking about those things and where we wanted to live. Phoenix, like any other big city, is very saturated. I know many of you will want to live in a big city out of dental school. So does everybody else. Keep that in mind. And so we didn't really feel like that was going to be what we wanted to do long term. We didn't want to be in an oversaturated place. So we sat down, and one of the stipulations in his witchy program was that if he practiced in an underserved area or in a rural area, that would cut the time in half. And we had both decided that we were going to leave the state of Arizona. That was our long-term goal, and practice in New Mexico, where I'm from. Yes, I am biased. Yes, I was from here. Yes, I wanted to move home. But there's tremendous opportunity here. There is tremendous opportunity here in New Mexico for any of you who are thinking about it. There's not a lot of people, so there's not a lot of dentists. But because there's not a lot of dentists, a lot of people are looking for dentists. We love the weather. You saw my backyard. I mean, how can you say no to that? If I'm selling you on New Mexico, good. This is like a wonderful place to live. And there was opportunity for growth. So my husband decided we were going to move out of Phoenix, that he was going to do rural practice for a year. And that would cut the 2 years he had left in half to only 1 year. So we moved to northern Arizona. So before I do that, I'm going to start showing you some practice pictures because we want to do some virtual shadowing. You will never forget the first cosmetic case you do. So my first job, Dr. Angel let me have the opportunity to do veneers on a patient. And I will tell you, photograph everything. Photograph everything in dental school, photograph everything in practice. It doesn't matter if you have the fanciest camera. It doesn't matter if it's on your iPhone or your iPad. It doesn't matter if it's in a point and shoot. Take pictures, because then you will have definitive proof on your growth and experience as you continue along this journey. So my very first set of veneers in my very first year of practice. I think I had been practicing 1 month before I did this. So my second job, we practice in this very small town called Cottonwood, Arizona. And maybe some of you know where this is. Maybe some of you have heard of it. Probably most of you never have, like I had never heard about Cottonwood. What we did know was that there was a community health center there that was looking for a general dentist. They understood our commitment. We were very transparent when we were applying to these positions about how long we intended to be there, because it was fair to them. I encourage you, in applying to school, in applying to your first job, and any subsequent jobs after that, be honest, be transparent, because you never know when you'll need that opportunity or that person or that experience again. You never want to burn a bridge by later them finding out that you weren't being honest. Be honest, be transparent. So my husband told them that he was looking to practice a year, and that was perfect because they needed someone to come in right away. And that gave them a year of time to find someone to take over his position long term. So that was mutually beneficial for them. Cottonwood, Arizona has 12,000 people. It's about 15 minutes south of Sedona, Arizona. Many of you have heard of Sedona, in northern Arizona. And there are maybe, I don't know how many there are now, but at the time that we practiced, there was 8 dentists practicing in this little town. We were 2 of them. Yes. So when we moved out of Cottonwood, Arizona, they lost 25% of the dentists there. So remember I told you all of you are going to want to practice in these big cities. The opportunity is outside of them. So this was my first experience with a Pacific Dental Services supported practice. And like many of you may be, I was pretty anti-DSO, that stands for Dental Service Organization, out of dental school. And what does that mean? Dental service organizations can be large or small corporations that help manage dental offices. Pacific Dental Services just so happens to be the largest dental service organization in the world. And they had a big impact in my school at Colorado. They had a lot of lectures. They hosted a lot of lunch and learns. I knew several dentists who practiced with them. And I was really concerned that practicing for a dental service organization, what a lot of people refer to as corporate dentistry, that my autonomy as a provider was going to be compromised. That someone was going to tell me what to do, how to practice, how to take care of patients, how many patients I needed to see a day, what kind of dentistry I did on those patients, and that I was just going to be kind of a turn and burn or a drill and bill kind of dentist. And so when we were looking at opportunities in this little town, and this office came up because they were looking for a general dentist, I shared my concern with my husband. And he said, well, it's just a year, and then we can go back into private practice, and we can buy a private practice or join private practice, build our own office. But it's just a year, but we need to work here. We need to live here for a year in order to move to New Mexico. So apply to the job, see more about it. And if you don't love it, it's not a long-term commitment. So I met with the regional manager of this area of Arizona, northern Arizona, that interviewed me for this position. We spent 2.5 hours in the first interview, and the majority of that was me talking, because yes, I am a talker. And I asked her a lot of questions, and I shared all of those concerns that I just told you about. And I can't tell you how wrong I was. So each of these practices are privately owned. They're owned by a dentist and supported by Pacific Dental Services. This practice at the time didn't have an owner. It had another young associate doctor who had a few less months experience than I did. So it was a pretty unique practice, and their patient flow was tremendous because, remember, this is a small town, 12,000 people. And in many small towns, dental insurance is not a big thing in practice because it doesn't have to be. So this practice that accepts dental insurance was a big deal for this community because a lot of people had dental insurance and wanted to go somewhere and not have to drive an hour or an hour plus to find an office that accepted dental insurance. So this office was very busy because it did accept dental insurance. And she shared with me that a lot of the team members of this practice had been there a long time. So retention and people staying at a job, what does that tell you? Obviously, they like something about that job, right? And she encouraged me to go and visit and see a day in this practice. And she was just a wonderful person. She is a wonderful person. She's still very much in my life, almost 6 years later. And I went and shadowed, loved what I saw, thought internally, okay, if I don't like this, I just have to stay a year and then I'll be good and I can do something else. So I joined Cottonwood Modern Dentistry as an associate dentist, and I was there a year. And that is when my life as a general dentist changed forever. So I was introduced to some very unique things. This is digital dentistry. A lot of you are going to have the opportunity to experience some of this in school. And for that, I'm very envious because I had no experience with digital dentistry at all in school. It just wasn't I don't know if it wasn't a big thing, or there's just so much to learn. Honestly, dental school is so short. You're like, what? Dental school is so short? Weird. I was in school for like 9 years of my life. Dental school is so short and there's so much to learn. When you graduate dental school, you are dangerous. That's it. You are dangerous. You are not an expert. You are not a professional. You go into practice to practice. And it's just amazing to me. We're in such a unique healthcare field because we're one of the few that has direct patient care in a surgical specialty and, I'm going to speak as a general dentist in a surgical specialty, 4 years out of school. We're surgeons. I cut into tiny little organs with blood supplies and nerves every single day. We do microsurgery. We're talking about millimeters here. It's on live people that aren't asleep. Or, most of them aren't asleep, at least in my day-to-day. This is unbelievable. It's remarkable. 4 years dental school is not enough. Your commitment to learning needs to start on the day you graduate from dental school. Many of us will graduate with egos. I was guilty. I thought I knew a lot more than I did. And every year in practice, I realize how little I know and how much more I want to learn. So there's another part of my why. I love learning. New things are exciting. If you don't like new things, this profession probably isn't for you, because it's never ending, nonstop learning. But at a certain point, you develop such a strong, good foundation, it gets to be really fun. And you start getting really good at certain things. All right, so my second job, digital dentistry. The picture on the left is a CEREC machine. It's a modality to make to do dentistry in your office. So in the office, I can make a crown or a veneer. If you came in with a broken front tooth, a significantly broken front tooth, I could fix it immediately. It was my hands, my work, my technique, my design. You're going back to what I'm saying again, my why. I wanted to do it with my hands. I wanted to have my hands in it. And this is not about like your type A, type B personality type, want to have full control. No, there's some art in dentistry. Not some, there's a ton of art in dentistry. And this allowed me to be the artist from start to finish. When you're a general dentist, a lot of you will practice in situations where a lab is very much involved. And kudos to our great dental labs, because there are certified dental technicians out there. I work with some of the best in the world, in my very biased opinion, that help me look like the most spectacular dentist because of their skills. But the frustration is the time in between appointments, right? So we're all about instant gratification. You get a patient ready for dentistry, and even if you have a lab that works right across the street from you, maybe it takes a couple of days to get the dentistry back. My dentistry is done in 2 hours. Now you think about a rural town with 12,000 people. How many dental labs do you think we had in our small town? That's how many. So for us to send our dental work out, patients waited a while for it. And if you broke a front tooth and they couldn't fix it right away, and you had a wedding, or maybe it was your wedding, which had many situations like this. Can you imagine someone being able to fix it in one day? Things happen. 4 years ago, I had a 21-year-old walk into my office. On his 21st birthday, he was enjoying an adult beverage, and someone thought it would be funny as he took a sip of a bottle to bump it underneath it. He never had a cavity before. He'd had routine dental work his whole life, 6-month cleanings every 6 months, and they broke all 4 of his front teeth when they popped that bottle into his face. He found my practice because of that machine on the left, because in many of my reviews, it talks about same-day dentistry and fixing things in one day. And in 3 hours, I was able to fix all of his 4 front teeth exactly the way they were before they were ever broken. And if he takes good care of them, they are going to last him a long time. So this was tremendous for me. On the right side is an intraoral camera. And that tiny little camera taught me more about patient education and getting my patients to say yes to the dentistry that I was recommending than any speech, lecture, words, verbiage, papers, handouts that I ever could use. Because it's one thing to explain something to someone, right? Like I'm explaining it to you right now. It's an entirely other to show them a picture of their own mouth on their own body, of their own self, and educate them about the problem so that they can make a good decision for themselves. And that's really a key focus in my practice now and my development as a general dentist over the last few years is learning how to talk to people. So you think most of you are probably good at holding a conversation. If you're going to be a general dentist, this is very important, but you learn so much about speaking to them in practice. So that tiny little tool, again, life changer. So now we're taking more photos. I'm going to show you my next big case, my second year in practice. And this woman came in and she said she'd always been ashamed of her smile. She said it was crooked, that it was dark. She didn't want to look like she was, what did she tell me? I don't need to look like any of those people in Hollywood. I just don't need to have brown teeth. And I don't want my smile to be crooked. And she was very opinionated, wanted to be very involved in her dental work. So this is something that I got to do in the office by myself. So the first case that I showed you was done by a lab. And this case is my first opportunity to do my own dental work. My second year in practice, I started learning that not everything also is found in a textbook. So you see a lot of crazy things in school and you think, I'm never going to see that. That's never going to walk into my office. Well, in a rural town with only 12,000 people, you see a lot of unique things. So this gentleman came in and he had an abscess that was draining out the side of his face. So again, growth continues. I'm 1 year in practice. He had zero pain, just noticed that one day one of his teeth was bothering him and then it stopped bothering him, so we ignored it. Right? Can't see it, must not be a problem, like many people believe. And then all of a sudden he noticed that pus was coming out the bottom of his face when he scratched a scratch that was there, and that it didn't go away, that he'd scratch it and clean it and then it'd come back, scratch it, clean it and come back. So he was talking to his neighbor and his neighbor said, you know what? Have you had any bad teeth in your mouth? And he said, you know what? Come to think of it, not long ago, I had a tooth that was bothering me, but it stopped. And he said, well, I think you should go see your dentist. So anyway, this was my first, not my last, abscess that was draining out the side of someone's face. So what do we do here? We take the infected tooth out. We actually had to make an incision in this gentleman's face so that we get all of the rest of the infection to drain. Once the tooth's out, infection's gone, we put him on a good round of antibiotics. He's very lucky he didn't die from this. Yes, you will deal with this all the time. People can die very easily from dental infections. What we do save lives, regardless of what a lot of people think. And I was able to treat him. All right. More development in what I do and learning my limits. You notice that my pictures get better the longer I practice. I told you I encourage you to take lots of pictures. So I'm sure a lot of you can guess she didn't like the gap in her teeth. She referenced herself as a hillbilly. It's always very sad to hear these wonderful people that you meet every day talk to you about how they feel about themselves. So you are part psychologist, part doctor, part artist. There's just so many wonderful things about general dentistry. So I told you I have an in-office dental lab with my CERT machine where I can make crowns and I can make veneers. In this case, this was outside my comfort as a second year dentist. I was 2 years out of school. I couldn't get the design right at the time that I wanted to close those spaces to make it look very symmetrical. So I made the decision to send it to the lab. So we're going to do a little reflection here, and that's what she looked like. And to the right is where we finished. And because this one experience, this patient, oh my gosh, she must have sent 20 or 30 people in the next couple of months to this practice. But development continues. I'm realizing my whys. And being able to give someone confidence and giving dentistry to people who need it and want it most, very satisfying. I learn more about what I can do myself in practice. So this gentleman was 19 years old when I met him, and he recognized that he had really not committed to keeping his mouth healthy. 19 at this point, right? And you all maybe know someone like this, you'll see someone like this. You'll certainly see it in textbooks if you get into dental school. But he had committed to getting himself healthy, and he was doing everything he could at home to be as healthy as possible. If you look at his gums in the upper left picture, they look really pink and healthy. He was doing what he could. He was congenitally missing some permanent teeth, so that's why his smile looks a little tilted to one side, because he was missing that tooth. And in one visit, we were able to give him that smile on the bottom. So we do a post-operative check a couple of weeks later. Anytime I do a big case on someone, I want them to come back a couple of weeks later. I want to check healing, take some photos. And he shared with me 2 weeks later that he had been brave enough to ask the girl of his dreams, as he called her, on a date, and that they had a date later on that evening, that same day that I saw him. And geographic success, I never saw him again after I left 1 year in this practice. But, I always think about this case too. This is one that I got to do with my own hands. All right, so a year in this incredible practice with tremendous personal growth, my husband and I made the decision to move to New Mexico. We do a lot of research. I'm actually not from Albuquerque. I'm from another city in New Mexico. But when we looked at opportunities in practice growth, and I'd had such a terrific experience with this specific dental services practice, my husband said, I want to do what you do. I want to be able to do crowns and veneers in the office. I want to be able to do porcelain fillings in the office. I want to do digital dentistry. So I brought him over to Blizzard Dental Services, and we wanted to go to a city where there was the opportunity to buy not one, but 2 offices. So this was my third, and hopefully my last, you recognize this picture from the very beginning, job. And this is the practice that I own now. I'm sure some of you may have noticed that this office is called Cottonwood. Yes. Smiles Dentistry and Orthodontics, and that's because the neighborhood where my practice is in the Cottonwood area of Albuquerque. So I just think, I believe in fate, and here I was going from Cottonwood Modern Dentistry to Cottonwood Smiles Dentistry and Orthodontics. It was not planned. It was just fate. So now let me tell you about developing the place where I wanted to work. I was in this practice for several years before I decided that I wanted to buy it. There were many different reasons why I bought it, but ultimately I saw it as an opportunity to build something that was my own, to build a place that I loved coming to. There was tremendous potential, and it was the right price point. And so a few years ago, I bought this practice, and I will tell you that I want you to remember every person that helps you be the best dentist or that you can be, because without them, we really are nothing. Again, I'm going to go back and reference general dentistry. In the 9 recognized dental specialties, there's going to be a lot of support. But here in my practice, I have 3 dental assistants, and again, very biased opinion, they are the best of the best. And part of the reason why they're the best of the best is because I have worked very hard to commit to teaching them as much as I can so that we can work together and kind of just be one person. They're my right-handed people. So on the left is Stormy. In the middle is my lead dental assistant, AJ. And my cute little shorty there is Cassandra. Dental assistants, we just celebrated National Dental Assistant Appreciation Week last week. This is a picture we took last week. And dental assistants boy, they're like the cornerstone of dentistry in terms of being a dentist and providing great patient care. Without them, I could not provide the care that, even if I wanted to try as hard as I may, I could not provide the care I need to without them. And then there are supporting people, your hygienists. And I treat my hygienists like I do specialists, because their understanding of gum disease, of oral health, of oral hygiene, how you take care of your teeth at home is just unmatched, right? You continue your practice as a general dentist or a dental specialist, and you certainly learn more about how it is to fix teeth and treat systemic whole body health, because we're not just tooth doctors. We are not. We look at everything as a whole being, as a whole person, but your team is everything. So Stormy, AJ, and Cassandra are my dental assistants in my practice, and they've all been with me for years. AJ has been with me the longest. I hired him as an associate doctor because this practice did not have an owner when I joined it. I hired him as an associate about 4 months after I joined the office. And Cassandra and Stormy joined me shortly thereafter. I have my operations manager, Casey, who's on the left, kind of blonde hair, and I have a benefits coordinator who helps with insurance, helping patients afford the dentistry that they need, Danielle there. And then on the right, taking exceptionally good care of one of our patients is Sarah, my hygienist. In my practice now, it's a pretty big office. So you all will join offices of all varying sizes. Some dental offices have one chair, and the general dentist does a lot of everything. Some dental offices have 12 chairs. My practice has 9 right now because it's made for more than one dentist. Each of these people that I'm showing you makes me love going to work. And I genuinely say that. Every day I get up, I absolutely love going to work because of them. And that's my other hygienist. I couldn't find a picture of her in practice, but that's Christina. And we have Hygiene Appreciation Week, and we went out to lunch. My team is just wonderful, and they make me the dentist that I am now. So continued practice growth. I had a patient who had prepless veneers. So what is this? This is where there's absolutely no drilling done on a tooth. She shared with me that her teeth had always been small, that she had always been very embarrassed of them. So about 12 years prior to me meeting her, she had these prepless veneers done. And now many of you are thinking with that picture on the upper, like, gosh, there's staining there. There's one looks more crooked than the other. The color is a little dark. I mean, of course, you can have my reference photo underneath. But at the time, 12 years ago, they were probably, this changed her life. And they lasted 12 years. And she was getting some chipping. She was getting some staining. So I want you to remember that you are dentists, not God. Nothing you do will last forever. We are just poor substitutes. But you hope that your dentistry lasts as long as possible. That's the goal. So that's a long time for dental work. And she wanted a brighter smile, a more full smile. She felt like her teeth still looked pretty small, even with the prepless veneers. So the bottom set, we go from, I told you my first 4 veneers, to the second patient I showed you was a case of 6. To the third patient was another case of 4, and now it's a case of 12, where the big picture starts getting bigger. So when you first start practicing, you start looking at every tiny little problem and trying to figure out a solution for each tiny little problem. And as you continue to practice, you start looking at the big picture. And I told you, now in dentistry, we look at systemic health. So we don't just look at fixing one tooth. I showed you the gentleman that had the abscess draining out of his face and how many, many people die from dental infections every day. So there's so many things in dentistry that can affect not just a person's oral health, but systemic health. So this certainly was affecting her self-confidence. So we replaced her prepless veneers with another set of prepless veneers. So the teeth on the bottom didn't require any drilling on her natural teeth. It was her natural teeth beneath that. We removed her old veneers and replaced them with 12 new ones and gave her a little more full, wider smile. So now a lot of you are thinking, but what about the bottom? Why didn't we treat the bottom? So we look at the big picture, and this is why taking your own photos is so important. Let's look at her smile. Everybody shows a different amount of tooth when they smile. And this is the ha 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 smile, right? The true smile, not the, posed for smile. This is a true smile. So when she smiled, she truly did not show any of her lower teeth. So the conversation was made, to fix the lower teeth. But when we took all the photos and studied them together, as long as we got her into a very balanced, healthy, sustainable bite, they didn't need to be treated. So we chose to, again, treat only the upper 12 teeth. So in the second photo, you can appreciate that she has a more full smile. She was so happy. She said, my teeth don't look small anymore. And this is just changes in light reflectance and contours of certain teeth. Her smile looks more full. It follows the natural contour of her lip, and it was brighter. And it's really amazing because I have a lot of different techniques for getting smiling photos from people, those genuine smiling photos that make your eyes crinkle up. And just by fixing her upper front teeth, you can just tell, you can feel a little bit more happiness in that second photo. This photo I took a couple of weeks ago, and I was able to fix this gentleman's front 6 teeth in the office in one visit. This is my dental work. He is a forest firefighter, and he jumped from a plane to fight a fire, and landed in a tree. He missed his landing, landed in a tree, broke his back, and broke his front teeth. And obviously, his back was the focus. He's very lucky. He was able to walk. He regained full motion of every single one of his extremities, and he has no residual pain from this. And then secondarily, he broke all of his front 6 teeth. So he came to my office because a friend of his had told him that I did in-office dentistry in one visit. And he was really interested in getting this fixed right away. So we actually flew from out of state to come and see me so that we could fix these for him in one visit. And this was the final photo. So the last set of photos I'm going to show you goes back to my why. I met this woman 4 years ago. I was in this practice just a few months, and she brought her 92-year-old mom to see me. I told you that my interest is in providing dentistry to people who need it most. And that is, so many people will neglect our older population. That's just very frustrating to me. Or they'll recommend things that they don't need, that don't prolong their life or make their life better. So when her mom was not in good health at 92, but certainly doing a lot of aggressive dentistry on her mom was not the right idea. We want her mom to be comfortable, infection-free. So her mom came in with 2 lower front teeth here that were severely decayed that needed to come out. But I will tell you, the way I feel is that I will always want my front teeth. So I like to talk, masks aside, right? A lot of people will see your smiles, and I know how valuable my front teeth are to me. And I didn't want this 92-year-old woman to be without her front teeth after I took them out. So I didn't charge her anything. We took the teeth out that they were bad, and I came up with a solution to replace the 2 front teeth so that she could have them for the remainder of her life. And her mom passed away a couple of years ago. And she came back to my practice after her mom had passed away to have a dental visit of her own. And she sat in my chair and brought up the story of me seeing her mom. And she doesn't live in Albuquerque. She drives from out of town to see me. And she shared that she knew that she had neglected her health as well. She neglected her dental care, and that she was very embarrassed to smile, that she looked like an old woman. These were her words, not mine. That she never smiled, that she felt lethargic and tired, and she felt like it was because of dental infections in her mouth. She couldn't chew well because when she chewed, her teeth hurt. She couldn't drink cold or hot water because both hurt. So she really tried to keep all of her food and beverages lukewarm. And because I had such empathy for her mom, that's why she came back to my practice. I never do dentistry because of how I feel other people might perceive it. I do it because of how I feel when I take care of the people that are in my chair. I know that when we look on social media, all these, I have my own Instagram, and a lot of dentists look at my photos as well. When I post those photos, I hope that young dentists see them. I hope that potential patients see them. I want to share a story. But when I'm treating those patients, it is because I love them. I want them to feel confident about themselves. I want them to be healthy. And I wanted to share that with her. And that goes back to my why. You talk about how we all want to help take care of people. But how? Why? This is where she was when we first started. And she was right. She had many dental abscesses. She had a lot of decay. She had severe periodontal disease. And we were at the point where none of her teeth were restorable. So we made the hard decision together to take them all out and replace all of them with an implant-supported prosthetic. So we put all of her teeth on implants. So this is called an all-on-4. It doesn't necessarily have to be 4 implants. Most of the all-on-4 prosthetics that I do are all-on-6. I had tremendous growth in practice. I've learned the things that I love about dentistry and the things that I will never do again. I love implant dentistry. So she went from this to this. These are kind of like bridges on implants. They are about the most natural way you can replace all of someone's teeth if they were to lose them all. For many of you, if you were to think about losing all of your teeth, I mean, if you were like me, I have nightmares about this. This is the way I'd want my teeth replaced because they don't come out. They are fixed in place. And you can chew and eat whatever you want. As long as they're done well, and the bite is stable and set in a very healthy position, these can last forever. The implants themselves, the titanium posts that these are supported on, will likely last her the rest of her life. And this is where she ended. Now, this is incredible because this photo was taken a year later, after we'd fixed her teeth and her smile. And she wore the exact same outfit to my office. I did not ask her to. And when we took all of these photos, she looked at them and said, "Oh my gosh, people are going to think I don't have any other clothes if you share this, that I only own one outfit." And I said, "You couldn't have planned this any better." So she just loved that. It was her favorite outfit. But again, you can feel the happiness that's in that smile. And you can see how her jawline was transformed, how the color of her skin looks different, how her nose and her cheeks look different. And again, this is my why. I love what I do. For those of you who are considering it, do it. Dentistry is the best profession out there. I am, again, a general dentist, so I do generally everything. And I just Every day I look forward to coming to practice. I never know what I'm going to find. I've been doing it long enough that I'm very comfortable in most of the procedures that we do. So now I'm just adding to what I can do, adding to all the things that I know how to do. So I'm going to end with this. How do you want to practice? What kind of dentist do you want to be? Think about after school, what are you looking for? Do you want to work in a community health center? Do you want to be in private practice like I am, supported by a dental service organization? Do you want to be an associate? Do you want to mentor? Many of you are going to try and successfully do it on your own. Most of you won't. Find help. This will help your growth. This will make your growth trajectory like this. I wish that first year in practice, Dr. Angel helped me tremendously. But after that, I wish I had had someone in my office with me, walking me through these procedures. In the office that I'm in now, I have the ability to reach out to dentists all across the country who are doing these types of procedures, who can help me learn. How do you want to practice? What kind of dentistry do you want to do? This is me, full circle, in Guatemala, in the clinic that was opened by the Pacific Dental Services Foundation. From that lecture to the clinic, my husband and I go every year. This is near and dear to my heart. This is where my mom is from, where I was married. And unfortunately, we're not going to go this year because of the current situation. I can't wait to go back. So find your why. 3 things. Create a vision. Why do you want to do it? Create a brand. When I tell you Nike, Google, YouTube, Facebook, Instagram, a lot of things come to mind, negative or positive. You're going to have a brand too. You have the ability to create it yourself. Start developing that now. How do you want people to think about you? What do you want them to think behind closed doors or say about you? All of these things matter. I looked at social media when I first looked at the first office I was going to join. I know people choose my practice because of what is written on social media or my reviews. I look up all my associates on social media and I find them. And the last thing is value proposition. What makes you unique? Remember I told you when you apply to dental school, what's going to make you stand out? The same thing applies when you're a dentist and you're looking for a job or patients are choosing you. Write these things down, commit them to memory, reference them throughout your journey, change them, make them fluid, allow yourself to change them, be okay with changing them, figure out your why. This is the greatest profession. Every day is a blessing. And I hope you ultimately enjoy it as much as I do. So thank you so much for letting me talk today. I'm here in Avril. Again, I told you I was going to give you my contact information. That's the name of my office, my address, my email address, my Instagram. Message me, call me, email me, whatever you'd like. And if you have questions now, please feel free. If not, again, it was my absolute pleasure.
Awesome. Thank you so much, Dr. King. Your passion and excitement for dentistry was so apparent, and I'm sure everyone watching loved it. So thank you so much. We just have a couple of questions that we can answer really quickly because we do have a little bit of time left. So the first question is, what are some misconceptions that your patients have about oral health, and like how do you educate them?
That's great. Great question. The first one is that if we have a cavity on a baby tooth, why should we fix it? Because it's going to ultimately fall out. That's a very common misconception because in my practice, kids are the lifeblood of general dentistry. If I win over kids, I win over families. So I believe education starts at the beginning. And I explain to patients every day, all day long, how important baby teeth are. Some people are born without permanent teeth. So imagine having to try and hang on to a baby tooth. Another misconception, let's see. Toothpaste and whitening properties around toothpaste. Don't even get me started with charcoal. That would be another 45-minute lecture. For all of you wondering, message me. I will tell you more about it. But there's a lot of misconceptions around dental products and what's good. And every day in practice, we turn towards education. And the last thing, the biggest misconception out there is that periodontal disease or gum disease isn't a big problem. 50% of people suffer from periodontal disease. 50%, there's three of us in this meeting, three of us right now up on the screen, myself, Mahira, and Avril, the two administrators. 50% of people have periodontal disease. That's all I'm going to say. Patient education about a disease that they can't see a lot of the time, they can't feel. That's a struggle. And as a general dentist, that's something I work with every single day as a person who periodontal disease runs in their genetic makeup. I am more likely to have it. This makes me fiery about teaching patients more about keeping their teeth for an entire lifetime versus just a short amount of time. Last misconception, last one, I'm going to lose all my teeth eventually. So, I mean, straight shot to dentures, might as well get dentures now when I'm 23 years old, or it doesn't really matter, I'm going to lose them. If I get a cavity, oh well. There's nothing more cruel than putting someone in a traditional denture. There's nothing. The last prosthetic I showed you, that is a very, very expensive prosthetic. And even though it's the best way to replace teeth that are going to be extracted, it doesn't actually replace natural teeth. So it's important to keep the teeth that you're born with for your whole life.
Awesome. Thank you so much. We can do one more. So someone said, I have an interview tomorrow. I'm in desperate need of interview advice. What can I do?
Good luck. We didn't really touch on interviews. You're going to be nervous no matter what. Be honest, be transparent, and be yourself. They're going to ask you, most dental schools will ask you the cliche interview questions. If your best friend could describe you, how would they describe you? What's the last book you read and why? What instruments do you play? You wrote that on your application. What does that mean? Be ready. Go up, Google the most commonly asked interview questions, read through them. Some of these people are going to ask you them. Have answers ready. Be ready to answer those questions. But honestly, be yourself. What's going to separate you? What's going to make you the person that they choose out of all of those people? Once you get an interview, that's your opportunity. So be honest, be candid, be yourself. A lot of people that are very, very good at taking tests aren't very social. So this is your opportunity for people to get to know you. Be honest, be prepared. And lastly, practice. Practice. Have your best friend sit across from you and ask you the questions. It's less scary with someone that you love who knows you. Practice these questions. Practice an interview.
Awesome. Thank you so much, Dr. King, for your presentation, your answers. They were wonderful. And thank you, everyone, for joining us today. We'll have the quiz up soon, and it will count as 1.5 hours this time. So have a great day, everyone.
Have a great night. Thank you.
Bye.